I actually, in my clinical practice, try to give a very simplified version of how heart attacks occur to my patients. I generally use drawings. I try to give them a sense of the cross-section of the artery and then how it is seen from inside, and what happens when it starts, and how it grows, and how it ends up with myocardial infarction. And I try to tell them the importance of oxidized LDL and some other factors. Within this context of vulnerability, I try to introduce the inflammation. I think that's a very difficult concept to convey to the lay public. Inflammation, which is usually associated with infection. So I think we have a long way to go to really convey this message of vulnerability, particularly when I think that it is so complex for us to understand the full scope of vulnerability. But I think that it is important to give the message to the lay public that there is more than just gradual narrowing of the pipes that's going on in here. And it also can be tied. I sometimes tie this explanation of vulnerability to the general health of the vasculature and perhaps the general health of the body, and how it can only be affected really in the real terms by major lifestyle changes in the general well-being of the human being.